Good evening, everybody. Boy, I can't believe that we're going to week 11 already. Our time together is almost done. And I was thinking today, I was in clinic today, and I was thinking, oh my gosh, I've had some of you students for many weeks through Women's Health as well. So I'm going to miss you. I wish you all the best. Because after this, you just have one more course, right? And then you're done. So let's see what we have in store for week 11. Okay. All right. Week 11. Let's do our overview here. Bone disorders can be caused by injury or cancer, inherited, occur as part of a child's growth, or sometimes for no reason at all. Some bone disorders can cause pain and difficulties walking, whereas others cause no symptoms. Providers base the diagnosis on a thorough history, close observation and examination, and the selective use of x rays and other diagnostic tools. Treatment depends on the disorder. Children's bones grow continually and reshape themselves extensively throughout childhood. Growth proceeds from a vulnerable part of the bone called the growth plate or epiphyseal plate or epiphysis. And this is the area of growing tissue near the ends of the long bones in children and adolescents. In remodeling, old bone tissue is gradually replaced by new bone tissue, and many bone disorders come from the changes that occur in a growing child's musculoskeletal system. These disorders may get better or worsen as the child grows. Other bone disorders may be inherited or occur in childhood with no other reason. So let's see what else we've got on here. The objectives and readings for the content. And we're going to our clinical practice scenario. And this is no different than what you've been doing in the past. I want you to choose your patient. And I want you to write about it just as you have been in the past. So don't look at this stuff. I want you to do exactly what you've been doing in the past. Because you've been doing a fabulous job. And I think that it's a great exercise in learning objectives related to the pediatric population. Now, it says that you do not need to respond to anyone else's post, but I want you to disregard that because this clinical practice scenario is talking about the ethics of treating a minor, and this is an important topic, truly. And if you would like to incorporate some of these concepts into your clinical scenario, that would be fabulous, but it's not required. The one thing that I ask, I don't want you to repeat any case clinical practice scenarios that have been already presented on. We've had a host of wonderful presentations. So whatever you present on, I want it to be something different. So no repeats this week. And also, I am expecting you to respond to other people's posts because really this is all you're doing this week. And I don't think that that's too much to expect. So let's have you do that. And don't forget the 20th at 7 p.m. is going to be the final review. That's going to be conducted by Nikki. I will be around for part of it, but we'll have to break away at 8 because I have a final review for my advanced patho class. But please, if you have any continued issues, reach out and I would be happy to help you in any way that I can. So I look forward to reading the discussions and have a good evening.